Folks, we want to say welcome to LMTV, coming to you live from the Central Medical Store here in Caldwell. And this place, as you can see, was constructed by the Ministry of Health with support. So as you want to pan the camera down, and you see vehicles are already loaded and they are making their way out to carry drugs to various health facilities across the country. And this is exactly where you have stored this area. You know a bit of information about this place. I want to say welcome to LMTV.
Good afternoon, and I say thank you. It's good to be back here. This is my second time coming here, and I see the atmosphere look good. The facility has changed. Security stay tight. When we came here, before you access this building, you have to do a fingerprint, and it's still the same.
It's still in place. Yeah?
Yes. So the issue of security is actually still the same. But looking at the environment, I'm seeing that
I'm here to give you the current look of this facility. But when we came this morning, we saw vehicles line up, and for different reasons, you understand that some vehicles coming directly from the Ministry of Health, and they are out of
15 seconds. You want to come back, Osa, because of the temperature in there is different. You know, drugs are actually intended to be stored in a very close and cool facility.
So I'll hold you briefly, Aaron. I'll hold you because we got to usher in.
Yes, certainly.
Yeah, so let's usher in
the leadership of our excellence, of Honorable Dr. Louis Photo. Medicines and medical supplies are available in sufficient quantity to all of our 576 facilities across the country. Major hospitals, the 36 hospitals across the country. So as we speak, distribution is presently ongoing. We are almost on 90% of the 2025 Q1 distribution. We are hoping to conclude the distribution process by the end of March at the Ministry of Health. We got other partners that have committed to the rest of the other programs, like the malaria control program by USAID, and the HIV, TB by Global Fund, and then the reproductive health commodities,
where all of the drugs in country are stocked.
For both medicine and any other medical consumables which are needed for the country. So as you would be to making the tour, it every quarter, every 3 months we are supplying the person.
I mean, between now, let's say right now and back then, what has it been like in terms of the timely supply of a medical equipment or
system? We have broken the system for infrastructures to human resource as far as essential medicines availability. But since we took over, there are a lot of improvements and for the public consumption. And we also want to say thanks to His Excellency, President Joseph Bakar Sr. for the level of support that the Ministry of Health is getting from this government.
Okay, so we want to pause just.
You see a whole lot of drugs in stock, and here you see on the other side, so alphabetically, you will see B, and you see A, you see C, D, E, F. So they are arranged in that and Caldwell. And here they these are folks who are here and making sure that the proper medications are directed to a needed facility. You have stockpile of essential medical equipment and medication that are here. So this zone, we load the truck to go outside.
So that's how it is.
So when I look on my far left, I see controlled drugs. What exactly is happening here?
So in fact, if I can try to summarize the warehouse arrangement here,
Okay.
we try to ask the national regulation regarding the controlled substances. So for those medicines, they have a restricted access.
Okay.
So it's only the pharmacist who has access to these medicines. That's why
Also doing verification. I also brought here for final verification, and from this side, you have then taken it over to the dispatch zone, from where you have vehicles coming very close to the
Bravo.
I don't know where is it. Told you in a jiffy here. So this is a live coverage of the Central Medical Store in Caldwell. This is where you have the essential drugs in Liberia. They are stocked in here. But very briefly, we want to join the interview with the pharmacist here at this medical center, or not medical center, but the Central Medical Store. So let's join him very briefly in an interview.
Medical bank. The medical house. Yes. Okay. We're going to come back to you and go around with the tour, but let's speak briefly to the chief pharmacist. Welcome again, sir. Thanks for joining us.
Thank you again, Nelson. I'm glad to be on your show. And just to buttress what the pharmacists at the warehouse have said, and again, if I may repeat, we inherited a broken health system, a broken health sector, where for every year over the past 6 to 7 years, our counties were receiving medication maybe once or twice for the past 6 to 7 years. But the regular program supposed to be full quarterly distribution every year. And not just full quarterly distribution, but it will be full quarterly quality distribution of essential medications. And then these medications should be affordable, they should be available, they should be accessible. We are talking about 5.2 million people that the government is responsible for. So you're not supposed to joke with medications.
So what's the current status like? In the case of rice, sometimes we go out of stock. Everybody complaining revenue high in the country. We get plenty of drugs in the country right now. Let's talk in the colloquial way small.
So yeah, let me talk in the colloquial way. We got plenty medicine in the country. Yeah. Last year, the government of the Republic of Liberia honored His Excellency Joseph Numa Boakai, were able to commit 4.7 million. Let me break the word commit down. They gave 4.7 million US dollars to the Ministry of Health to buy medicine for our people.
Okay.
Yeah. And the 4.7 million dollars, we're supposed to get it from Finance Ministry. So the Ministry of Health, headed by our Minister, Honorable Dr. Louis M. Poto, worked along with the Ministry of Finance and were able to get all of this money. And because of that, it helped our people and to make sure, it helped us to make sure we put plenty medicine in the 576 hospitals, clinics, and health centers all over this country. As we speak, we have 44 health centers, we have 36 major hospitals, and then we have over 400 plus small clinics. When you go to Gola Koni, you go to Bokondre, you go to Foya Kama, Foya Dunu, you go to Kample, you go to Butuo, you go to all the other areas in our 13, 15 counties. Medicines are there, except where you don't have clinics. But even where you don't have clinic, people who live far are able to walk to a nearby clinic and they will see plenty of medications.
So that, I want to go you very briefly. When you look at the facility here,
Yeah.
you see a whole lot of drug in stock.
Yeah.
But then, if you get to the local health facility, you will hear people talking or saying, well, we come at the hospital, there is no medication, we don't have drugs in stock, and then they are referring us to a pharmacist to go and get drugs. How can you reconcile the two?
I think that has been over the past 6 or 7 years.
Okay.
If you hear that personally, then that's just politics. Maybe people just they don't want to talk. Yeah, because in every area you have detractors, you have oppositions, you have other people who don't mean well for the current regime. So whether you are in opposition or you are in position, the best thing there is to make sure that we handle this situation for the benefit of our country. Everybody, even you who interview me, you got people, you got all people who can afford in all of the 15 counties, all the villages, we got people there. So it's not about politics. It's about making sure that our people get what they need.
So how can you convince the public that drugs are actually at various health facilities across the country?
I can convince them, number one, because distribution will be for the Q1 distribution for this 2025 will be concluded in 2 to 3 days. So we are going almost 95 to 97%. We just left with few districts or maybe few facilities. But region 1, region 2, region 3, region 4, most of the regions, every one of them receive medication at the county. Okay. And then Play International, that is our third party logistics, they are already into the field, taking it from the depots and carrying it to the clinics. You go Buchanan, you go Grand Crew, you go Grand J, you go Sando, Maryland. Most of the facilities already receive medications.
So we want you to take us around and show us these medications you're talking about.
Yeah.
We want to show our audience
so you say
what you're talking about firsthand, not just you talking about it, but showing us exactly what you have here. Good thing is that we have the WFP representative here. The WFP manages this facility, so we want you guys to take us around and just show us the different supplies you have.
Yeah.
Now, what's the duration of each of the supplies?
The duration of each of the supply? Yes. I don't understand your question.
When you supply, how long?
Okay, we do every 3 months. Every quarter have 4 months, but we use almost 1 month to do inventory and preparation to resupply. So every 3 months we carry medication to the counties.
Are you taking into consideration the low on some medical facilities? So if you are saying you do quarterly supply,
the reason why the low was on most of the facility because all the facilities were not receiving medication.
Okay.
In past, for the past 6 or 7 years. But presently, with the 576 plus facility receiving medication all over, the low will drop. Okay. Because no need to run from Ghana to go to Redemption. No need to run from Redemption and go to JDJ. No need to run from JDJ and go to ERWA. So every catchment population has a hospital or clinic or health center. Okay. So because of that, the demand has dropped. We then need to sustain the process. So you ask the question, how can we convince the people that medication are available? Medication already gone for the quarter, and then we are moving around to show you that we already prepared for the next quarter. Okay. So let's move around now.
Yeah. Well, so he's Dr. Kides. He's the chief pharmacist of the Republic of Liberia, and we've been in a brief interview before touring this facility. You have to get a glance of what exactly is the operation of this facility like. So if you see here, you see A, you have B, you have C, and you have D, and we were told.
Yes, all from here up to that end, it's HIV related commodities. This is where we keep them.
Wow. You need this entire corridor, right?
Yes, even the other end.
Okay. For HIV related supply.
Yes.
Okay.
So from A to D.
Up to here.
Okay, so from like you see here,
corner up to here, this week, everything is HIV related.
So alphabetically.
And then recently there was concern that one health facility was running out of HIV related supplies to the UK aid card and stuff like that. Here they're going to be class. Is the supply here, like you're talking about a good stock of HIV medications, is it out to all other health facilities or are there specific health facilities?
Actually, the distribution doesn't select the facilities. So, and as far as I know, the recent USAID suspension didn't affect the availability of commodities as of now.
As of now.
Yes.
So, Dr. Peter want to make a clarity on the allegation that came from the EAW hospital over the issue of HIV and AIDS medication.
Well, that information was just hearsay, they say, but the information is not true. No medication.
The information about the shortage of HIV drugs.
Yeah.
EAW hospital.
Yeah, the information is not true. We got sufficient HIV medication in stock and then to the Bureau facilities.
Okay.
So information is not true.
So you want to take us around further? Which Bureau?
So folks, you listen to
This is for TB. TB related to commodities. Yes, tuberculosis.
so for letter
E and F.
and F.
Yes, this
Essential medication for TB related.
yes. Of course, these ones you see on the floor, they are under verification. This is the recently government procured the commodities for the essential medicines. We have what we call the program is EDP, essential medicines. So we are in the process of verification. We are done with the internal auditors from the Ministry of Health and the PPCC. Then the next step will be to put them in their respective locations.
Okay.
So folks, from A to D, from A to D is meant
E
for
and F is,
HIV related,
Okay.
but then E and F are for
Then when it comes to
tuberculosis.
G,
Okay.
this is nutrition. So nutrition commodities are kept here. You can see exactly is a plumpy nut, which is used for the severe acute malnutrition. So this is where we keep the commodities for nutrition. Then after nutrition follows malaria. As you may be aware, malaria is one of the biggest morbidities in Liberia, of course in our African countries. So from this rack H up to J, you see this is where we have our malaria related commodities. Okay. So they are kept here. Again, the pallets on the floor, they are still part of the IDA supply, the government of Liberia supplies, which are still under verification.
But I see the IDA. What is the IDA?
IDA is the supplier.
Is the supplier?
Yes, is the
so
supplier.
You have different suppliers that supply these medications? Up to 4 suppliers. Okay. Okay.
So we have the RDA, we have the global pharma. And then we have medication coming in from all of vendors. The FARA, the PVF, and all of vendors. Yeah. But for essential medicines, we have the RDA, we have the global pharma, we have the Bento pharmacy, and we have all of vendors.
Okay.
Yeah.
So so this is still the second for malaria. So it means that all of the health facilities across the country.
So folks, you see, this is letter J, and the medication that are stocked here are malaria related. That's why you want to zoom.
Except in the government hospital, yeah, some private facilities receive medication from here, but not for all programs. They receive medication for maybe TB, HIV, some reproductive health commodity we send to all of private facilities, like Caldwell Hospital, ERWA, and all area. No, they don't pay for it. It's free.
Okay.
We send it to all of private facilities.
With the exception of USAID and WFP, what are other partners who are storing to food?
With the exception of USAID and WFP, we got other partners like UNFPA. We have WAU products. You can donate medication to the GUL also. And then we got UNICEF. And maybe we have other WHO. Yeah, those are all our partners.
Okay. Let's take for instance, if a government-owned medicine is found in private clinic or hospital, are there ways to identify if this medicine is owned by the government, but they are selling it
in a private institution?
Yeah, this is what the government tries to do. That's why we are trying to get medication from vendors. We are trying to get medication from vendors that will produce medication and put the Ministry of Health logo on them. Production is presently going on as we speak.
So for now,
some of the medications already have a label on them, like the RDA medication.
Okay.
They have label on them.
Yeah,
the global pharma medication. So if we find those, the minister already established a health task force that is on the field.
Are they really working?
Yes, they are working. They don't expose themselves, but they are working.
If someone want to if someone want to identify the government-owned drug in those private facilities, say, look, this is a government-owned drug, but they are selling it in private clinic. How can they do it?
We use the batches. All the medications they have batches. So the ones that are going on, they go over batches. So just in case of any suspected theft, we use the badges to do investigation.
Are there penalties? Do you have are there penalties?
Penalties? Yes. We got a Liberia National Police, so government, the Ministry of Health will send it.
So we want to. This is letter J,
But I see.
and see.
What is it? Maybe the WFP, yes, in fact, as you already conclude
Distribution round. So it means we did the picking from the racks for this specific health facility. Then the commodities are here pending the verification. So there is the person who did the picking, another person will do the verification. After verification is completed, now we pack and then take it to the dispatch where we load the car to send the commodities to the respective health facility.
So this place storing a lot of drugs for the country, and then I see at the back I see this should be a fire extinguisher. What is the safety measure put into place here when it comes to fire safety? Because if this place is not properly extinguished, and you don't want to have this entire place going.
Yeah, in fact, as you can see, we have the fire hose, and not only this one, we have them across the entire warehouse.
Okay.
Being a medical facility, we don't use the water sprinklers, because they would cause more risk. So this is what we use. There's the fire hose, and we have the fire extinguishers across the warehouse. The team is trained on how to handle in case of such situation. But of course, we have the fire safety services of the country which would intervene in the case of that unlikely.
Are they stationed here?
They are not stationed here, but this is their jurisdiction. So in case of need, we would be contacting them.
So which section?
So from K up to M, this is where we have family health commodities. So this includes the reproductive health, such as contraceptives and all other related essential medicines.
Oh wow!
And I see label on some of them. I see the UNFPA.
The labels is mainly the donors. Okay. Sometimes there is a donations made by UNFPA or by UNICEF, so they can put their labels on the cartoons.
Yeah. So where we still touring this facility.
So this is so even up to this point, up to M.
So from K to M.
Yes. So then from N, like from all these pallets you can see here.
Yeah.
This is what we call EDP, Essential Medicines Program. These are commodities exclusively procured by the government of Liberia.
Okay.
So for the Liberian population. So this is where we keep them.
So are you saying that these are not donor?
No.
Not any of the medications?
No.
So these are procured by...
They are procured exclusively by the government of Liberia.
So for N?
From N to Q.
Okay. So if I may get out before we cross this place. As you said, this medication was procured specifically by the government of Liberia. The 4.7 million that government gave to the Ministry of Health was the one that was used to procure the medications. And because of the proper management We sent medication to all the 576 facilities last year, and up to now we still managing until we can start procuring for this year.
Is it mixed drugs, mixed medication? Or
Yeah,
kind of medication?
essential medicine. Only essential medicine. You have the antibiotics, you have the painkillers, you have the syringes, you have needles, and so many things. Antibiotic, painkillers. So we don't want to name all the classes of antibiotics. We don't want to different things. But we pass through certain vendors to procure the medications, like UNICEF. Even though UNICEF is a UN organization, but the government Liberia, because we want quality drugs, so we gave them money through support from World Bank to be able to bring the medication from overseas. And you will see UNICEF label on this medication, but it does not mean that the money was spent by UNICEF. The money was spent by the government of the Republic of Liberia, but we only ask UNICEF to help to procure them for us. And for them to bring it in at a cheaper price, cheaper rate, because of transportation and rest of them, they have to put a UNICEF international local, so that when it passes through other places, the prices of procurement will reduce. But it is government money, not UNICEF money. Okay. That's what we try to clarify.
Thank you. So we say at end.
Yeah.
So this is mixed now. Mixed medication, mixed medical supplies at this point. So and is it we still going? With
yes. And O to P.
Okay, I see P is all the way.
Yes, just up to the corner, just okay, everything there. Then up to Q. So everything up to here.
Okay.
So is EDP.
So these are medical consignment
and then
that were procured by the government.
R, this is EPI, immunization supplies. You can see the syringes, vaccines, and other things.
Yes.
For the down, we still have EDP commodities, because these are heavy. As you can see, they are very heavy.
When you say EDP, what do you mean?
Essential medicines, essential drugs. So these are very heavy. That's why we place them down here, because for safety reason, we don't put them up to
Water. They are grapes, the sodium chloride, the ringer latte, the B5W. These are heavy commodities, so you don't put them up. Okay. You have to keep them down so the weight can bring the shelf down.
Okay.
Yeah, but they are still EDP, procured by government and some other partners.
Okay.
Yeah.
So for this entire room.
yes.
Wow. So if we were to put a cost to everything here at this facility, what will we be talking about? How much are we talking about? WFP, you want to come in first, and then we will go to the pharmacies. If we were to put a cost to everything you manage here, the different medical supplies, different category, you took us through the entire segment containing the HIV medication, the nutrition, the one for tuberculosis, the ones procured by the government of Liberia, mixed medical supplies, and all of that, and everything. How much will we be talking about?
As of today, the value of commodities we have in this warehouse is more than 10 million. So this is 10 million USD. So 10 million, but it is more, because as I showed you, there's a cargo still being verified. So it's more than 10 million.
Wow.
Yes.
You want to speak to this, sir?
Yes, yes. He's speaking to the one that is in the system already, in the M supply. So it's around 10.
What do you mean when you say M supply?
That's a software system to be able to monitor the warehouse and be able to tell us exactly where the medications are, the quantity of medication, the value, and the rest of them. So that's a closed software that manages the warehouse to help them to be able to give quick inventory and the rest of them. And then that 10 million is the one that is within the system.
So why is it that
containers are coming in? We just uploaded 6 containers from the one that UNICEF brought, and then the one that Africa CDC brought, the one that World Bank, UNICEF procured for the government. that our mentioning, and the one that Global Pharma and other people brought, they have to do proper verification, because we don't want to put expire medication in the YM supply. So you have to verify them, authenticate the cost and the quality before you can enter the software system. So when we do all the verification, we'll be talking about close to 15-16 million.
Yeah, that you just forget about expiration. So when you procure, how long each of your medication take before you get expired?
We procure medication with expiration they at least 3 to 4, 5 years. And every year we use most of the medication. So 3 to 5 years by that time, the medication will not be on the shelves. Because every quarter new medications coming in. Every quarter. So at least 3 to 4, 5 years is sufficient.
Do you have vaccine in stock here at this facility?
Yeah, did I show you the how they call it? The EPR, the EPR supply. All of these things are EPR commodity vaccines are all here. Yeah, the whole shelf you're looking at there, they are vaccines.
Okay.
And vaccine related materials.
Okay. Is there anything else you want to show us just before?
Maybe if for the other program commodities, we have community health medication. So all these commodities you see on the floor here, and this side is for community health for the entire country. Okay. So the community health team from the Ministry of Health, they do the kitting. They do kit for every community health worker, and then we do supply to various facilities. On the right side is for eye health. So everything that's related to eye, we have the commodity, they are related commodities stored here.
Okay. Wow.
Yes.
Yes. So what are some of the challenges you have in managing your facility?
The challenges is the system improvement, because it's always an improvement process. We just took over the management of CMS, I think, end 2023. We started with the new process, new procedures, new environment, and we have different partners. So I wouldn't name them as the challenges, but it's just a learning process that we are undertaking.
Okay. Yeah. All right. So it's been a great one. And
so before we leave you very briefly, I want you to speak about the issue of power here at this facility, because this place you have to keep the drugs on a cool temperature, I guess.
Yes. Temperature is one of the storage conditions which are required for safe medication. As you've seen, we have the air conditioning system, which makes the place to stay cool. We have also the cold storage for temperature required for specific medication 2 to 8. And to be able to sustain that power supply, we rely on LEC power supply. Of course, for sustainability purposes, we have 2 backup generators. So it means whenever there is a power cut, we shift to the generator 1. In case power stays off for long, we go to the second generator. So we have the 2 generators and then the ADC. That's the power supply source we are relying on.
In terms of manpower, do you think you have the needed working force here at this facility to do the job?
As I mentioned, it's a continuous process, and for now, is okay. We are good to do the job, and we've been doing it since last year, and now we are doing it. So we are okay for now. If any change, adjustment could be discussed with the Minister of Health, who is the owner of the facility, of course, and then see if anything has to be adjusted.
So do you have any suggestion for national government for this facility?
I only have the appreciation, because this facility is quite good. I had the chance to be in other countries out of Liberia. Facilities, comparing it with the Liberian population, 5.2 million, the space is enough. Of course, whenever there is increase in the population size, the facility will need to be adjusted. But this is a long-term process, is not a short-term action.
It seems to me that everything here is like 100% for you.
Not 100%, but close to 100%, comparing to where the facility was in the previous years, as mentioned the chief pharmacist.
How long has it been since the WFP started managing?
Now is 1 year and a half.
About a year and a half.
Yes.
Okay. And you spoke of significant improvements.
Yes.
Thank you very much.
So, Guy, you want to wrap up very briefly before we take leave of you finally?
So, ladies and gentlemen of the press, I want to take this time as we conclude this current status assessment of the CMS to firstly say thanks to His Excellency Joseph Imam Baka, President of the Republic of Liberia, for the level of support given to the Ministry of Health under the leadership of Honorable Dr. Louis Mapia-Poto. And I also want to say thanks to the Honorable Minister of Health for the level of innovation, vibrancy, and viability that she brings to the institution, and the level of transparency that she brings to the institution. And she makes sure that every money committed for essential medicine at the Ministry of Health, that money is properly expended for the benefit of the Liberian people. As I mentioned, we have about 576 health facilities, public health facilities across the country that benefit from this money that we get from the government. And even all of private facilities also receive some commodity from us as it relates to HIV, TB, and the rest of them, reproductive health commodities. Sometimes when the facility run, even JFK has its own budget, but sometimes when JFK is stranded for medication, sometimes they call on us and we use somebody very medication from here and send to JFK, the National Referral Hospital for the country. And as we speak, the 4.7 million that we received last year were properly managed, as you can see, the warehouse, and we are still managing until we can get this current year 6.2 million that were allotted. The government did well. They started with 4.2 million, and then they have allotted, they have increased it to 6.2 million.
Is that 2 million?
Yeah, so the government is actually doing well.
Okay.
From 4.7 to 6.2. So we know that before we end this regime, we'll be getting to our target. Because our target to be able to manage this country for 1 year, just for essential medicine, is between 18 to 20 million United States dollars. That is our target for the Ministry of Health. So with the little that we got, the 4.7 million, we were able to reduce the stock massively. That nobody is actually crying and saying no medication. And now we're going to 6.2. We are managing still, but it's not sufficient. But under the good managerial capacity of the Minister of Health, I think we are doing well. She's doing well with her team. And we want to appeal to the government to begin to have incremental addition every budget year until we can start getting close to the 18 to 20 million that we need for the health sector. And one thing I want to emphasize, quality health care is still possible in the midst of limited resources. But for sustainability, it's not that easy for any country to be able to supply free medication continuously. So there's an idea of the drug revolving fund under the nomenclature, quote unquote, the community pharmacy, that it was in the problem before this current minister took over, and she wants to make sure it's actualized and brought to fruition. So we already piloting the aspect of the community pharmacy at the Ministry of Health to few facilities. That pharmacy is headed by a medical doctor, Dr. Raphael, supported by other pharmacists around. So that community pharmacy will be the way forward for sustainability in the long term. So that medications that the 6.2 million that the government committee, that when we send the medication to the facility, we can be able to collect little things and be able to revolve the medication. So that at the end of the day, if a government delays in giving all the allotment, we can still be taking that money around. But on the average, the president is doing well, the minister is doing well, finance ministry is doing well, and I think the team is good. And thank you for coming, and we look forward to having another interview a day in the future.
That means the issue of no drugs now is not in the past.
The issue of no drugs is on Pluto. It's not here. Thank you very much.
Just tell the public your name, the chief pharmacist of the Republic of Liberia, so that they can know you.
So I am Dr. Joshua T. Peters Jr., the Director of Pharmaceutical Services at the Ministry of Health, and the Chief Pharmacist of the Republic of Liberia.
Thank you very much, Dad.
Yeah, thank you.
Well, folks, there you have it. And my colleague Aaron will join me as we bring this broadcast to our end. But you listen to the chief pharmacist of the Republic of Liberia, and some of the things he said very briefly as we wrap up is that the issue of drugs, yes, in Liberia, when they took over, they had $4.7 million, and then the government of Liberia pushed it up to 6.2. And but on the overall, they are anticipating that to solve this problem, you will need 18 to 20 million dollars to solve the issue of drugs in Liberia. And at the moment, you have 576 medical facilities across the country that are being supplied on a quarterly basis. Can you imagine that? If you look in the back, you see the folks who are already arranging, packaging medical consignment for the 556 medical facilities across the country. What do you make of this? Very briefly, Aaron.
Yeah, so I think a healthy population is a very good nation. If you are not healthy, you won't be here today to do this interview. So looking at the facility and I'm seeing the jobs are here, it tells you that the issue of no job that the health pharmacist said is no more existing in Liberia. And Liberians who are in various counties, various towns, various villages, you should rather show that enough job is currently in country that will serve the need in years to come. So I mean, it's a very good step taken by the Ministry of Health and her partner and the government of Liberia to supply this particular institution with the needed jobs, very essential jobs.
And one question I was asked is the issue about people going to health facility. Yeah. You will come here and take the supply, but then when you go to the health facility, they will tell you no drugs, and he was definitive on that position. He said it was in the past, but as we speak currently, once you get to any of the 576 health facility across the country, you will be served with medication.
And one thing that pleased my heart from this interview, I think, it was the Ministry of Health is putting into place a modality where all drugs are being procured by the ministry to have a stamp. If you are not government institution, when that particular drug is caught in your institution, you have the police to contend with you answer question. So if that is put into place, I think meaning we are moving somewhere, because there are folks who will take the drugs from the government facility and carry it to their own facility and make huge profit out of it from those who go to the health facility. So if the Ministry of Health can just do that particular aspect, meaning you have enough jobs in the country.
And lastly, what he spoke about is there was this news trending on social media that the ELW hospital said they went out of HIV and AIDS medication at the facility. So he rubbished that allegation and said, no, if you come here, you see drugs that are in stock for HIV and AIDS related purposes.
Yeah, so like you said, according to him, there's enough drugs in the country for HIV and AIDS. Mind you, that a lot of Liberians are currently living with that virus, and you have drugs that are actually available to suppress that virus. So, I mean, from the health pharmacist, it tells you that indeed what happened at the ELW hospital, I mean, it was just maybe an oversight. So, in country, you have enough, there's no need to worry about our brother and sister who currently live with that particular virus.
So, folks, we want to bring this broadcast to an end. We've been touring the Central Medical Store in Caldwell. This is where you have all of the drugs that are distributed to the 576 medical facilities across Liberia. They are stocked in here and are distributed on a quarterly basis. So we want to bring this broadcast to an end. Thanks for watching. Damo Afofana has been behind camera and making sure you see all of the shots coming through your camera. And my colleague Aaron Talu has been here making sure that jointly we bring this broadcast to you. My name is Aisha Riva on behalf of the entire team here from the Central medical stool here in Caldwell, bidding you a pleasant afternoon.